for joining us. We are just about to start the Right from the Start webinar focused on covering doula services for moms. We'll just wait a second while people join us in the webinar. And I'm going to stop share so people can see everyone who's joined us here. My video is not on. That's a problem. I turned on my video. My name is Leanne Barrett, and I am Senior Policy Analyst at Rhode Island Kids Count. We are a proud leader of the Right from the Start campaign and a member of the steering committee for it. And we're here today to talk about covering doula services through Medicaid and commercial insurance. It's a really exciting day because the hearing on the Senate side is going to be tonight at 5 o'clock. We are also very thrilled when we saw Governor McKee's budget come out, and he included Medicaid coverage for doulas as a priority in his proposed budget as well. So we're very excited for the program today, and we have a great group. But first, I wanted to make sure that folks on the call know that we have simultaneous Spanish-English interpretation for the Zoom, and it's turned on, so anybody who wants to hear Spanish words translated into English, in case we have anyone speaking Spanish, go to your interpretation globe on your Zoom thing, Zoom bar, and click on English if you want to hear it in English, click on Spanish if you want to hear it in Spanish, and that's been working really well so far, and we have Ruth here providing interpretation for us. So with that, I wanted to say thank you so much for Rep. Leanne Barrett for joining us, and Senator Ana Quezada, who was on earlier. I don't think, is she on right now? Not right now, but she will be joining us. She's speaking, and we did get her connected. And we have Senator DeMario on as well, who's been a champion and at many of our Right from the Start campaign events. So I am going to share screens just to go over a little bit more about the campaign. Oops. Okay, so our campaign is led by a great team of advocates in Rhode Island, and we're working to advance policies for young children and families. We're focused on both legislation and budget, and we want to ensure that all young children and their families get off to the right start, regardless of race, ethnicity, immigration status, family structure, family income, or zip code. And during the COVID-19 crisis, it has become even more clear that policies and programs that help families with young children are essential for a strong economy and public health. Investments now will help our state and Rhode Island's young children and families weather this crisis and emerge stronger on the other side. This slide gives an overview of who's on our steering committee. We have a steering committee of 7 members who have put together the agenda, and we make decisions together about adding something or key strategies. We talk regularly, and we've also got a great group of campaign champions on our website. If you go to rightfromthestartri.org, you can look at the full agenda. You can click on Take Action to send messages to your legislators, and you can sign up as an organization to be a champion of the Right from the Start campaign. I'm just going to go quickly over all our priorities. The first one is really that we need to enact strong state and federal revenue policies, because the biggest challenge we have with all our priorities is not adequate funding to implement them. So that's an important one. Number 2 is pass the Rhode Island Child Care is Essential Act. That is also being heard in the same hearing this evening. Pass the Rhode Island Early Educators Investment Act to establish goals to increase early educator wages. Improve our state's paid family leave program, which is the Temporary Caregivers Insurance Act, so that more low-wage families can actually take the leave that they need, and that we can extend the number of weeks. And that we want to cover community-based doula services through both Medicaid and private health insurance, which is why we're here today. We really need to look at funding, particularly through Medicaid, for both Rhode Island early intervention and family home visiting, to make sure their resources are adequate to ensure adequate staffing and wages for staff, and that programs remain viable and open to serving all the families that need them. We want to maintain full state funding and children's access to RI Pre-K and Head Start. And our newest priority, actually we added this after we won, the housing and the early childhood facilities fund passed early this month. So we took that off our agenda and we added on this new priority, which we'll talk more about it in the coming weeks, but it's to promote maternal, physical, and mental health by extending Medicaid coverage for moms through 12 months postpartum. So before we launch into our program, and Q is going to kick us off, but I wanted to show a brief 2-minute video that our campaign put together that that goes over the issues.
I've had 2 previous pregnancies that ended in losses, and so for me it was really important that this 3rd pregnancy was just different. I wanted to feel like I was supported and just have a team behind me, and so I really wanted to seek out a doula for my 3rd pregnancy. She was there not only helping me with like my contractions, helping me breathe through everything, she was affirming me, and she was also supporting like my partner, so if he needed to take a rest, like she'll take over. It's just like a whole support system, really.
Doulas are well prepared and experienced in understanding the emotional ups and downs that moms may feel during their pregnancy, and particularly knowledgeable about the birthing experience. So they're not the person that delivers the baby, but they're the person that holds the mom's hand during this experience and supports her to do what she needs to do to get through the delivery and labor in a healthy kind of way. And then supports the mother after the baby is born in developing her relationship with her baby. As a doula, we doula the family. You know, we're not just for our moms or our dads. We're for the family unit. We're not medical staff. We don't do medical work. We're more of the digging into the emotional feeling of it and then encouraging you to advocate for yourself back to your provider. We really want you to have a relationship with your provider because that is the person who's taking care of your physiological being, you and your child. One of the things about Black maternal health here is Black moms die 3-4 times like we did our white counterparts. And so having a doula who can say, not only do I see you, but I see myself in you, and I want you to see yourself in me, it really makes a difference during that pregnancy journey. As a doula, you are attentive to that one family in that one moment. And that takes a lot of work, a lot of energy, and always researching, right? Because imagine if it's a family that you're not familiar with their culture. You know, you have to research the culture, learn their culture, engage with them. And so a lot of work goes into being able to support a family, especially with like certifications and trainings. Most trainings for you to be fully certified, it takes about 2 years. They're out in the field, they're taking classes, they're going to breastfeeding classes, they're going to childbirth classes, they're teaching childbirth curriculum. It's a lot of work. One of the things I love about being a doula is that I was able to be there during some of the most beautiful moments in people's lives, and it is always an honor and a gift to be invited to someone else's journey, and I never take that for granted.
Okay, thank you. Sorry for the brief disruption stopping the video, but my dog was snoring so loudly and I forgot that I can't put myself on mute, otherwise you can't watch my video, so you'll just might hear my dog in the background. But now I'm really excited that Senator Quezada has joined us, I've heard, so we'll be hearing from her lately, so welcome Senator Quezada. But next I want to turn it over to Q. First I want to introduce her, and then she has some slides to show, and then we'll stop screen sharing so everybody can see each other. But for Q, I've been working with her. I've only known her about 6 or 7 months at this point, but Q is a leader in the Doula Coalition. She founded Our Journey, and it's a maternal wellness organization that offers mothers in the Providence area compassionate, high-quality birth and postpartum services. Q, the founder, is a certified community health worker, a certified lactation counselor and educator, a certified perinatal educator, a certified doula, and certified maternal child community health worker. She specializes in empowering and educating pregnant mothers and families. The organization seeks to create equity among communities of color, although it is open to everyone in need of its services. So with that, I'm going to turn it over to Q's slides next, if I can get it to go past this YouTube slide. Okay, there we go. Q, you want to take over?
Sure.
And just
Thank
let
you.
me know when to move to the next slide.
Okay, I'll do a next slide request. So good afternoon, everyone. Thank you for joining us on the Right From the Start campaign. I'm covering doula services with Medicaid and employer-based insurance. My introduction, my name is Cortia Osorio. I go by Q, well known in the community. And I'm going to do a small presentation on supporting an equity initiative for maternal health. Next slide. So this is a small bio about me. My name is Cortia Osorio, and these are all my certifications. I'm a mother of 5. I'm the oldest sister, favorite granddaughter, graduate of Wright University, native-born Providence, Rhode Island resident. I'm currently attending Philadelphia University, also known as Thomas Jefferson University, for my second bachelor's in health services management. And then I will be returning while concurrently finishing my courses up for prerequisites for midwifery school. I'm the owner of Mama Blue Diaper Service. I'm the founder of Our Journey, executive director of the Urban Perinatal Education Center, which I'm developing right now. Co-founder and co-lead of the MoManga Collective, urban farmer and owner, operator of Quaintly and Journey Farm in Providence, Rhode Island. Next slide. So I started on my maternal journey as a perseverance to continue to believe that we could have a better maternal health care system for Black women and communities of color. And for the past several years, I have been fighting for equity and justice in the Black maternal health sphere. I started Chocolate Milk back in 2016, which is a Black breastfeeding support group to promote health equity amongst the Black community. Maternal child health specialist training hosted in 2019. I've hosted 2 doula trainings, co-founded the MoManga Collective, working on the Urban Perinatal Education Center, which will be a centralized hub in the Providence area, focusing on maternal health, doing a space for lactation, childbirth education, or breastfeeding, hopefully a milk bank, and possibly a small maternal health clinic. My goal is after that to help develop a BIPOC midwifery cohort, and eventually the final goal is to build a birth center. Next slide. But of all those accolades, when I was pregnant, I was just a Black mother in danger, simply because of the preface Black. They said that I have higher risk for hypertension, higher risk for this, higher risk for that, higher risk all around. But I wasn't for higher risk. What I was I was adversely targeted because of the prevalence of my Black voice being ignored in healthcare systems. Next slide. So what are we up against? Here we talk about Black women were only honored because of their ability to build the workforce, to create this nation, right? We were stock, we were chattel, we were property. We lived and existed to breed slave workforce to build the United States of America. And this is the history of stolen women in this country. We have been forced to wet nurse. We have been forced to deal with rape, the violence against our husbands, against our sons, against our daughters. Our children were ripped from us in slavery and we were starved. It's just such a violent history. It's such a violent brutalness upon Black women in this country, and then substantiated by poor and inequitable care in healthcare systems, right? So when we look at the history of Black women and why is this happening, we have to remember that this is the beginning in the United States for how Black women have always been treated. And unfortunately, we have been seen as the disposable population, right? Our suffering has been constant. In Rhode Island, the Rhode Island maternal mortality for Black women is 3 to 4 times greater than our white counterparts, right? And this is based off of data from our Department of Health. The Rhode Island Black infant mortality rate is 3 times greater than our white babies. And the Rhode Island Black wage for women is 57 cents on the dollar. And so we are continuously pushing what I call like the snowball uphill. We are fighting constantly for equity. We're fighting for our voices to be heard. We are loving, caring, nurturing women. We are gentle and we are kind and we love our children. But when we get into these systems, we're fighting for our lives. And that isn't what we should be doing. Next slide. So what is perinatal doula services? So perinatal doulas are professionally trained frontline workers for in and out of hospital care when it comes to maternal health, right? So this is a picture of me. Most of these pictures are mine. This is me with my husband and my doula and my dog. On my 4th child, right? So there is this belief that this is just for first-time moms and first-time dads and first-time birthing persons, and that's not true. It could be your first baby, your 5th baby, your 6th baby, your 3rd baby. Whenever you feel the need to be supported, to feel like you have enough education and awareness around your birthing experience, you can have a doula. So my first time was my 4th birth. This is my 4th child. Evangeline is actually a rainbow baby. Like Will Maris, I suffered 2 miscarriages, diagnosis unknown for why I could not carry my child to term. And I felt that I needed a doula. And so I went to the Doulas of Rhode Island, and I was able to get this wonderful doula, Jenny Gooseland, no longer practicing, but was a phenomenal doula for me. And she really opened my eyes to what it was like to navigate the hospital and what it meant to not just educate myself beyond just that surface level, but really educate myself on a holistic basis of how I was taking care of myself. And that included stress. Bias stress, discriminatory stress, racial stress that I was dealing with, violence in my community, how those things were affecting me, and ultimately how they were affecting my baby. This is an entrepreneur profession, right? So we are a workforce. We are an emerging workforce across the nation. If you've been paying attention, you'll see the Momnibus as a supportive national act that is supporting everything that the Right from the Start campaign is doing here on Rhode Island. So we are right in line with the national trend. As an industry, we do not support or volunteer or advertise for free work as a standard of practice for doula profession. In the state of Rhode Island, we want to make sure that every family deserves a doula, receives a doula, but also every doula deserves to be paid. Families are seeking qualified, trained professionals who could assist them in the most vulnerable time of their lives. Advocacy, education, and support. Being a perinatal doula is not about providing stand-in support for families. So we are not a replacement for your husband. We are not going to replace your mom or your aunt or your best friend in the labor and delivery room. What we are there for is to support you, because we're not just for the baby. And I'm not sure if you guys can see the bottom of my slide, but it says no one is willingly signing up for a 4-day hospital stay for fun. When families are being induced, we are there with them in the hospital, and the policy in COVID is you cannot leave. So we are there with you 2 days, 3 days, 4 days. We do not leave. There are no shift changes. It's you and us, and we are kumbayan in this space together for your birthing journey. And we're there to support you emotionally and physically. Next slide. So what does it mean to define this work? I love this picture because this is actually our graduate doula training back in 2018. And many of the doulas, all of the doulas actually from the MoManga Collective are from this training. But it talks about the work of what we do, right? A community-based doula is a birth worker serving families within varying communities. And they center around African descendant people, indigenous families, people of color, and understanding the importance of seeing a birthing individual, baby, and partner as a connected unit. This support is responsive to the whole birth experience and considers how physical, emotional, mental, and spiritual experiences impact pregnancy, labor, birth, and the postpartum period. So this bill is about building towards our state priorities of equitable care beyond the hospital, into the home, not mandated by government support, but supported by families, right? So we are prioritizing families and their needs. So it's not a cookie cutter thing, right? So it's not like one doula, every experience is going to be the same. what I truly love about this bill is we take in consideration when people want their support. And so let's say you had a very precipitous birth that just means fast, right? You went to labor and delivery, you had the baby in triage, but you really feel like you need support in postpartum, right? When you go home, because after you leave the hospital, who's there? The midwife doesn't go home with you. The OB doesn't go home with you. That super labor and delivery nurse does not go home with you. But your doula will be home with you. Your doula will be there to help you navigate this new space, this new transition, as you begin to blend who you are as a person into your new role as a mom, dad, or new birthing person who's now mom or dad, or however you choose to identify, right? So we're there to help you with lactation. We're there to help you even with bottle feeding. What is the best practice for bottle feeding? How to safely do that. We're there to help you as you transition with your baby's different hours as they're growing. And so what I love is that we consider all the modalities of the perinatal care and not just the birth, because it's not just about the baby. It is about you. It's about your family, and it's about your unit. Next slide, please. So who we are not licensed professionals, right? That is your midwife, that's family medicine, and that is the obstetrician. And they are here, they're part of this phenomenal care team that cares for you prenatally and postpartumly. But these are Rhode Island licensed professionals in the medical industrial institutions. These are not doulas. Doulas are professionally trained. We are evidence-based. We are empirically supported, and we are a best practice. We are certified. We are certified through the Rhode Island certifying board here in our state. And I have a little disclaimer there about who the Rhode Island Certifying Board is. It's the ethical standards and procedures for practice for its professionals. And they advocate and represent the competencies and standards to stakeholders. So there is a governing body here in Rhode Island for doulas. We're not just, some people think we're willy-nilly running into the streets or just showing up at hospitals with no training. No, most of us, if not all of us, who are certified doulas practicing and trained doulas practicing, we've gone through extensive training. We've taken professional development, right? It's not just you do this training and all of a sudden you're ready. Most times it takes about 2 years to be a fully certified doula because it's a lot of work. Again, as you saw from the video, childbirth education, lactation education, professional development, BLS certified, CPR AED certified, Safe Serve certified. So we're not just individuals who like babies or like moms showing up at your house. No, we are trained, we're certified, and we are approved to be where we are. Next slide. So this is simply a quick guide of what it takes to be a perinatal doula. So you start off, you have your licensing, you have your insurance, the code of ethics, which are training institution organization, as well as any of the Department of Health regulations that we have here, community, governance, and standard of practice, right? And not to mention the constant continuous professional development and recertification. As a certified lactation counselor, I have to meet so many hours of education and core competencies. As a certified doula, I have to meet so many education hours and core competencies. As a community health worker, I have to meet so many educations and core competencies. And this is a continuous basis. So this isn't a lapsed or expired experience, right? Like your licensed professionals, we are in constant training too. We are making sure that we have the most up-to-date information, that we are on the latest trends when it comes to the safety and welfare of our community. Next slide. Happy World Doula Week! Just so happens it is World Doula Week. So if you happen to be on a social media platform, you will see World Doula Week. And our theme this year is Doulas Find a Way. And that is what we're doing. We are finding a way because every family deserves a doula and every doula deserves to be paid, and we need to get it right from the start. And if you want to learn more about us, you could follow any of the links, preferably RI Doula Bill. If you want to learn about me, you could follow me at www.journey.com and learn a little bit more about what we're doing. Thank you so much for having me, and I look forward to the rest of the talk.
Thank you so much, Q. You were an awesome lead-off speaker on this and lots of other things. So we really appreciate you. And I had no idea it was World Doula Week. That must be why we're having the hearing and the Zoom. It worked out perfectly. So next, I want to turn it over to a mom and introduce Saga Pappas, who has worked with a doula for her 2 children. So Saga Pappas lives in Warwick, and she's the mother of 2 children, Millie, age 1.5, and Hadley, age 3.5. She is here to talk about why she decided to work with a community-based perinatal doula to support her family before, during, and after the birth of her two children, and how the doula helped her family. Thank you, Saga, so much for sharing your story.
Thank you for having me. I appreciate it. I'll try to keep it quick. I have a lot of great things to say about doulas, so it's hard to keep it within, that time frame. But I never grew up knowing about doulas. I knew nothing about what a doula was, and I became friends with a doula and sort of learned really the benefits. And when we were pregnant and ready to have our children, we kind of went with that path. My plan was to have an unmedicated birth, and that was sort of a next step for us, was to have that support of a doula. And I am so grateful every day that we did it. So our first meeting with our doula was in our home. It was personal, it was loving, it was about building that relationship. She asked us about our relationship as a couple, between me and my husband, my pain tolerance, any traumas I'd been through, and really kind of how I liked to be and needed to be supported. We really just sort of built that relationship from the beginning. And that relationship continued until after the birth of both of my children. And it was just a nice change of pace from just a typical appointment that you would have. It was really about me and my husband and sort of what we were going to do together. He had never really been included in sort of this process. It was really just about me or the baby at appointments with doctors or, other ultrasounds, things like that. And he really felt like he was part of this now, and he was able to build some strategies around supporting me and what to expect. And I think him just being able to ask questions about the process was a huge help for him in general. For my youngest daughter, we had a doula present, the same one, and we actually had a ultrasound where they told us that she was going to be over the 99th percentile. So they kind of basically said she was going to be a very big baby. And it was pretty quickly that they told us that I should probably have a C-section. There was a lot of concerns for how big she was going to be and if it was going to be safe. And, I immediately reached out to my doula, and she gave me some really great evidence-based sort of information about my previous daughter's birth weight, just information about ultrasounds and, the inaccuracies just between a couple pounds and what that can mean. And so because of her, I chose to kind of advocate for myself and go forward with the natural birth that I had planned. It was really important to me to do that. So to even think about a C-section in that moment was really overwhelming, especially after having such a successful first birth with my oldest daughter. So we went through with our natural birth, and she supported us with just everything from, cold towels to, just reminding me to breathe. And she really brought my husband and I together through both of the births and gave him those moments of being able to support me, which is an overwhelming thing for a partner, because how do you support someone that you love in pain? It's a hard thing. It's not instinctual, I think, sometimes. So both my girls were born, 7 pounds, and there were no complications. Everything went just as planned. And after the birth of my youngest daughter, Millie, we were having a really difficult time with feeding, and we spent a lot of time nursing, and she just didn't seem to be getting enough milk. And we really brought this up to doctors and to the pediatrician, and it just never seemed to be an answer. And it was actually our doula who, at our home during a postpartum visit, really kind of was sitting down with us, watching my daughter feed, and her concerns were that possibly there was a tongue tie just from her experience with her own child. And we ended up seeing a pediatric dentist, and that's in fact what it was. We were connected with a lactation consultant, per the advice of our doula. And it just really, it's all these things that I never would have done on my own. I never would have known, I never would have had the intuition to seek out. And as wonderful as our doctors are, there's often these gaps that are missed because they're not in the home with you. They don't see those moments of just vulnerability where you're really having a hard time. It may feel in a 15-minute wellness check that, this mom is just going through the ups and downs of birth and after birth and postpartum, but sometimes it's more. And I think, it's nice to have that insight and that relationship with somebody. So we were able to get my daughter's tongue tie revised, and within weeks she was feeding like normal. And we really were sort of grateful for all of that insight and those just moments of that relationship and that bond that we had created, and those things that she knew that I wasn't just kind of having a hard time. There was something else going on. And I'm really, I'm here in support of all of this because we were able to, as a family, pay for a doula, and it's not something that I think everyone could pay for. And being able to, have that support and that relationship and that second set of eyes and the care that a doula provides is, worth everything. So.
Oops. Thank you, Saga. That was awesome. Another great. Oops. I'm muted? I'm not muted. Sorry. Thank you, Saga, so much for sharing your perspective as a mom. We've had a mom on every one of our Right From the Start events, and the story of how it helps families is really important. So now I'm going to turn it over to Dr. Ashley Lakin. She's a family medicine physician with a specialty in maternal and child health and works closely with doulas in her practice, and she's here to express her support for the doula bill.
Thank you. It's nice to be here. So I'm a family doctor, trained right here in Pawtucket at Brown's Family Medicine Residency. And then after family medicine residency, I did a 2-year fellowship in maternal and child health. And so my specialty, this is my life's work, this demographic that we're speaking about. I have the really unique privileged position of which most physicians and medical professionals don't have, which is this beautiful longitudinal relationship with families. So I provide prenatal care, I catch a lot of babies, and then I assume those babies frequently right into my practice. And so I'm able to kind of grow along with this family. And and like you said, seeing them as a connected unit and really seeing how all those parts play together. And there's this saying, which is not mine, although I use it all the time, which is that if doulas were a medication, as a physician, it would be unethical for me to not prescribe it to every single patient I encountered. I imagine that a little bit later, we'll get into some of the nitty-gritty about the data behind doula care. The impacts are profound and beneficial. Reductions in surgical birth, like C-section or the need for a vacuum delivery, expanded duration and exclusivity of breastfeeding, and there are many, many more. And so I think that emphasis on the intrapartum role that doulas play is incredibly important. I see it every day. And when I meet families in prenatal care, I often engage them strategically about conversations about doula care and ask them if they have a doula, if they've heard of a doula. And that just benefits me so much, and it benefits my family if they're able to engage in that care. But as Q beautifully highlighted, it is absolutely a equity issue. It is a social justice issue. Who does and who does not have access to doula care for financial reasons? And so when I look at my panel of patients, and I'm up in Woonsocket caring for a relatively diverse panel of patients, you know, the demographic data translates directly into who had access to doula care or not, and then into some of their birth outcomes. And so I kind of wanted to highlight a role that doulas play in the care of my patients, in addition to that emphasis on the intrapartum care. So comfort, assessment, them achieving their unmedicated childbirths like they want, them having less C-sections like everyone wants for them, and focus on the critical role that they play in the postpartum period. So as is already been kind of spoken to by Q and Saga, you know, a lot happens at home. Really important, beautiful things happen at home. And if I see someone at the hospital and we have their baby and we have our nurses having their eyes on them in the hospital for discharge, a lot can happen. I'm seeing them at 2 or 3 days postpartum, usually for weight gain, breastfeeding, chest feeding, lactation usually, or bottle feeding, weight assessment. Doulas are an integral part of the safety net of that vulnerable postpartum period. I get calls, I get texts directly from the doula community. I'm talking to so-and-so. This has happened to me in the last 2 weeks twice. I'm really concerned about their mental health. This isn't normal. This is scaring me. These are the alarm bells that I'm seeing. And it has allowed me to call that patient that day, move up their baby visit by 24 to 48 hours, and in one case, transfer them from my office directly to the Women and Infants outpatient mental health program. They are just integral to the safety net that we're able to provide for birthing people and families in Rhode Island. I can't tell you how many near misses had been prevented, whether it's a mental health issue or even medical issues like what's normal and what's not. Like, actually, I don't think that amount of bleeding is normal. I don't think that amount of swelling is normal. And to have those community but trained professional eyes on my families has been invaluable from a patient standpoint of care and safety, in addition to all of the amazing emotional support. So I just wanted to really emphasize the critical nature of them as team members, not only in what happens in education and labor support and preparation for birth and then the birth itself, but in that critical postpartum period. A couple of us on this call sit on the BRC committee reviewing perinatal deaths in the state, and so many of them are attributed to mental health crises and crises where people had more access to resources. They might be prevented, and so doulas are critical to that, and every birthing person needs one. Trying to think if I had anything else to say about that. I'm glad we're working on TCI. That's great. I think that's it. That's kind of all I had to say.
Thank you, Dr. Lakin. That was also great to hear the healthcare professional perspective. And I'm going to move right along. And next, we're going to hear from Senator Ana Quezada, who is the sponsor on the Senate side. And I know she's getting ready for the big hearing tonight. So, Senator Quezada, are you able to share some remarks about the doula bill? You're on mute if you're talking. Or it's possible she's doing 3 things at once and she's not, but I can come back to you, Senator Quezada, if you're not available right now. Lots of times legislators are trying to do many things at once, but she's been a huge champion. Oh, here she is. Yay.
I'm here. I'm sorry.
Okay, great. Senator Quezada, I'll turn it over to you. She's been a very big champion for children, families, economic equity, and I want to turn it over to you as the lead sponsor on the Senate side.
Well, first, I want to thank each one of you, all the advocated for doula. You guys, especially this year, it's done a tremendous job. Thank you, because you make us look good. Because behind us is not that many people know how many advocates working so hard, especially in this specific bill, but doula is one of. But I'm very optimistic that this is the year. We have it already in the budget, and that's a good thing. I want to thank Secretary Jones for being very helpful to us because unfortunately our new governor do not know anything about doula. When I have a conversation with him at the first, he was like, "What's doula? What that do?" And it was very interesting to have that conversation with Governor McKee because it was in the sand. Like when I got that conversation with Gina Raimundo, Gina knew what doula was because she used doula and she's a woman. But Governor McKee didn't have no idea what doula was, but at the same time, he was very willing to listen, to understand, and to look for information. And Secretary Jones from DHS was a very helpful person who helped me with Representative Quezada. That she done a tremendous job doing and this doula, and she was able, both of them were able to talk to Governor McKee and educate him what is doula. And it was a good thing because Secretary Jones put us in her budget, but at the same time, Governor McKee didn't took it off, and that's a good thing. I'm very happy to know that, and I've been in touch with Secretary Jones for a few times. We got a couple of Zoom meetings, communication over the phone, and it's been very, very helpful, very good. And I think, and finally tonight we're going to have a hearing. I don't want anybody to get surprised. It's going to be sent for the statute. There is not for any particular reason. It's just because every bill is being sent for the study. But I think before we go on recess, I think we're going to have doula on the floor. That's the conversation I had last night with Senator McCaffrey, Senate President, and Chair Miller. And in the Senate, it's not a problem. We've been passing this bill already for a couple of years. And unfortunately, I will not say done with doula because we're not going to be done with doula this year. But I think it's a lot more things that we need to do in the near future, even if we pass it this year, especially because private insurance. It's going to be a continual working on that issue. But other than that, I think on Medicaid, that would be the one that we're going to be able to pass this year. And I think we have to get data to make sure the private insurance understand how good doula is and how it's a win-win for everybody to have doula. And it's not about spending money, it's about saving money. And I think we have to find a way to show them that. But other than that, I'm very happy to see that going through. And I want to, again, thank each one. It's amazing to hear all the story. I've been listening to all and that video is very nice that you have. I received a letter with 900 people signed. I know some people called me that they wasn't able to sign in for today to testify. But unfortunately, I don't have no control over that. The only thing I can say is anybody wanted to send siempre yo tengo estos Zoom, alguien llama. Sorry, I'm calling you from my phone, and every time I'm doing Zoom, somebody decides to call me. I even forgot the loss I had. But I think finally tonight we're going to be able to do it. But I don't want anybody to be nervous or afraid when they see they're being sent to public for the study. I think they're going to take it out of the committee soon, maybe by next week, and then we can go from there. We need to continue working with the private insurance. Anybody who can give us a hand. I'm going to try to make a couple of appointments with them to speak to them. But I think once we have the data to show to them, I think it's not going to be easy. And all that is because of Obamacare. See, we make them to do it. The state has to pay for the service. They're not going to pay. And the state don't want to pay for private insurance to provide a doula service. I think the hospital can help us on that, especially women and infants. They've been very supportive of this legislation. Then I think that would be a good step to start working with the private insurance. If anybody had a question, but thank you for all the work you guys been doing.
Thank you, Senator Quezada. And people can, we may run out of time for questions, but you can put them in the Q&A and we can follow up with you if you have a question. So I want to go now to Susie Finnerty. She is our second doula on the call today, and she's another leader in the coalition. Susie is an experienced doula and lactation counselor in Providence, and a leader in this coalition to secure Medicaid and commercial health insurance coverage for doula services. She has been supporting families birthing in all birth settings since 2014. So let me turn it over to Susie.
Hi, thank you. Thank you, Senator Quezada, and everybody else for all of your excellent work. So I, and just to respond briefly to Senator Quezada's remarks, I was asked to talk about my experience as a doula, but all of the data is laid out like very clearly in the bill, and I won't bore everybody by reading the bill out loud. Because you would all fall asleep, but it is very interesting and you should read the bill. So talking about, my experience and what I see as a doula, and this doesn't necessarily even encompass only my experience as, we have a robust professional association here. We all have our own businesses. There are some teams, but we are very connected as practitioners. So how I've seen this work directly benefit moms and newborns, a huge piece of this is time in their home. We spend over an hour each time developing a connection and relationship that extends into the postpartum. People initiate doula care oftentimes during their pregnancy. This gives people a voice and an opportunity to speak. I see a lot of families wanting to understand their choices. They don't know what those are or how to find them. They have fears, traumas, questions, and these stories are intimate and they are sacred. I see people taking an active role in their pregnancy. We get to talk to them about moving their body, eating well, understanding the process. All of this can be made really difficult by pregnancy symptoms alone, and then mixed in information from families, friends, and the internet. The doula knows, does this person have multiple children that they're caring for? How many hours are they working? Are they okay? I see people getting to take ownership over their birth plan. A lot of my families feel rushed, judged, and not listened to during their appointments. Sometimes doulas give people tools to open a line of communication with their care provider to advocate, and there are times when we support a family to find someone else that's a better fit. We know that cesarean and induction rates vary widely from practice to practice and provider to provider. People deserve this information and guidance to a lower intervention practice if that's what their wishes are. People are often surprised that they can switch providers, and many people do at some point. The 2018 State of Maternity Care statistics presented by Evidence-Based Birth showed continued overuse of cesarean births, induction, and other interventions. I see doula care empowering families to ask questions and use critical thinking when recommendations are made, and really having conversations with their care providers. I see people begin to feel confident and comfortable spending early labor at home, knowing that their doula is just a text or a call away and can meet them where they are and when they need support. This gives both the pregnant person and their partner peace to invite the process, and it lowers stress. The hospital can be a new and intimidating place for birthing people. I see families benefiting from reminders that they are in charge of the decisions that are made, that they don't have to lie in bed. They can ask for time. They can have their questions answered. We can lower the lights so that it's not bright and in their face. People remember this experience for the rest of their lives, and they also have to go home and be parents. And it really matters what their experience is. There are times when the unimaginable occurs and a baby is lost. This can happen at any time during pregnancy. I see families relying on that emotional support provided by a doula and connection to that we can help make them to resources for grief and healing support groups in the community that they would have no idea about. The harm reduction in postpartum really starts prenatally, where families are able to consider a plan to fully recover, heal, and bond with their baby. So many families who hire me as a doula after birthing without one have horror stories of what happened when they came home from the hospital, physically overdoing it, suffering from depression, rage, anxiety, or pain. Without support, parents tend to suffer. When you are exhausted, it's hard to even know what kind of help that you need. When I can establish a relationship prenatally and give families space to speak and be heard, I see families move from a place of being conditioned to suffer and tough out pain and be able to identify and voice what their needs are. Again, in their home, in their own space, making them a cup of tea, help the baby breastfeed on their time and in their house. Does the parent need a nap? Do they need help baby wearing? This is really important because a lot of the maternal mortality tragedies occur within the first 40 days postpartum. One 6-week checkup is not solving this. And simply being present as a doula, asking if someone is okay and reminding them that they deserve to be okay can change the entire trajectory of the experience. And how this legislation is going to expand coverage to more families and improve health outcomes. We know that about 6% of births are attended by doulas, which is a pretty small percentage. In my role at our professional association, I'm on the board. We are often contacted by doctors, midwives, social workers to arrange doula care for people who cannot afford it. I have seen doulas reduce their fees. I've seen providers and professionals personally pitch in to pay for doula care. Community organizations have created scholarship funds, and people are using GoFundMe to pay for their care. I see doulas scraping together their own resources to pay for their training, childcare, transportation, and living costs. Doulas at times have to choose between being able to having income to pay their bills and working with a family that cannot afford their fee. Expanding doula coverage will give the opportunity for this to be brought to the remaining 94% of Rhode Islanders and also expand the workforce to meet that need in a way where people can actually live. Our society has a long history of lack of value for what is often referred to as women's work, particularly Black and Indigenous birth work, and it has no place in Rhode Island if we are truly committed to the health and safety of our families. When folks in these fields speak up about compensation, for example, we are often chastised and reprimanded for asking institutions to consider these needs. It's as if our leaders think we as caring professionals would be happily working for nothing if only our hearts were in the right place. The reality is, without compensation, people can't live and they can't do this work and they can't spend this time in people's homes. And if we aren't taking care of our caregivers, I don't even know what we're doing. And that's a really important part of this, and another reason why I'm really grateful to have the support of Senator Quezada and Rep. Ranglin Vassil, who has sponsoring the bill in the House as well. And what does this mean for both communities that are most at risk for birthing complications? Institutionalized approaches to treating Black women and pregnant people have continued to cause harm. We know that racism, not race, is responsible for these shameful statistics. Doula care gives families the chance to choose who their doula is and find their voice and ways of knowing and what that means for them to be safe and well and start a family. Outcomes are directly impacted by that time that's spent together. Sometimes this is unseen by others on the care team. We have a lot of visibility when we are in the hospital, but the time spent at home is vital to families. People who are experiencing risk factors that deem them a high-risk pregnancy need support just as much. In teams of specialists, the doula makes sure that the person isn't lost and that bonding is still prioritized. Doulas prioritize connection to community resources, support groups, parenting, and educational support so a family doesn't fall through the cracks, regardless of the challenges that a family might be facing. And the last thing I just wanted to say was that families are sacred, and that is kind of the hallmark of doula work, and that people deserve to have their dignity and body intact and not just survive.
Thank you very much, Susie, and thank you for your leadership on this bill as well. And I'm going to go to our second healthcare professional. Ana Sofia de Brito is a certified nurse midwife. She works also closely with doulas in her practice. So I'll turn it over to Ana. Ana Sofia, the whole word.
Hi, everyone. My name is Ana Sofia, and I use she, her pronouns. And I identify as a formerly undocumented first-generation immigrant Black midwife working here in Rhode Island. I just came over from Massachusetts, so two very close states, very different support systems, I should say. And I was working in a federally qualified health center where no one used a doula and no one knew what that was either. So I'm coming from a very health inequity, social racial justice lens, specifically asking for states, for the government, if they really want to help with all of these health inequities and Black maternal mortality rate, to really focus on providing doulas for Black and Brown folks and low income and other disenfranchised communities, because it's not the lone solution, because clearly we have a lot of work to do here in this country to help our women, but it's important that this service is accessible to not just wealthy white women or people who can afford it. I myself gave birth in 2019 and I used a doula, and that doula was actually gifted to me by another family because at the time, even working as a midwife, I didn't have the ability to pay someone to be my doula, and I didn't feel comfortable asking for an income-based sort of doula, like lowering their fees, because I believe in paying folks for doing what they're doing and how important they are in that system. So using a doula and having a doula student, so I had two doulas at the same time, really helped me, what everyone is saying, staying at home during the period of time in early, late in labor, where I didn't need medical interventions, where I didn't need to be under surveillance or medical surveillance in that time, where I could just be in my home and or labor uninterrupted with the support of my doula and the doula student, and not rely on my partner who was there to be the person to support me through that time. And so as a midwife who works mainly in hospital-based settings, so I'm not a home birth midwife and I'm not in a birth center, it's expected of me from patients when they meet me and they figure out what a midwife is that I'm going to be a doula too. And it's very important to realize that as midwives enter the medical industrial complex, we're expected to perform like doctors most of the time. And so unfortunately, midwives need doulas too, not unfortunately, fortunately, but unfortunately, we do not have the time to be in the room with you the whole time. We might have more than 3, 4, 5 or more patients at one time, and we have to check in. So the doula is our right-hand person, right? So for the birth to go the way you want, to be advocated, I'm all about advocacy, and I really want to be there for my patient, but I can't be there every single second, especially in a hospital-based setting. So again, just opening up the ability to pay for doulas for Black and Brown folks and white folks and everybody to have access if you can't afford it is so important. And if we can get this through, I think all of the communities and all of the hospitals and places and settings where birth happens and can really take off and help in reducing that maternal mortality rate that we have in this country. And with the last thing I wanted to say is I am so upset at myself that I did not get a doula or continue services for the postpartum period. I unfortunately suffered postpartum depression afterwards, and being a midwife, I was so humiliated and sort of shamed into thinking like, oh, I'm a provider. I detect this in folks, and to suffer that myself, I didn't reach out for help until it was just right at the edge of being too late. And so I definitely agree that doulas are needed in that postpartum perinatal mental health disorder realm as well, because it's so important. In the 2-week, 6-week visit, you can't encapsulate all that is happening at home during the first 40 days of the postpartum period and even the first year. So thank you for listening to me.
Thank you so much, Ana Sophia. That was great. And we heard, like, actually from as you as a mom and you as a professional as well. And the maternal mental health, as we know, in Rhode Island Kids Count, we did an issue brief on that. And it's extremely prevalent across all sectors of society. But the lower income you are, the more likely you are to have a maternal health crisis during pregnancy or in those 12 months after the birth of your child. So doulas are really important part of the safety net. So I am going to now turn over to our closing speaker, Rep. Leanne Quezada. I think people mentioned Rep. Marcia Ranglin-Vassell is the lead sponsor on the House side. She was unable to join us for today's Zoom call, but Leanne is the second sponsor, and she's been a champion and at all of the coalition planning meetings as well. She has MPH after her name and Rep before her name. She's a strong supporter of legislation seeking to improve public health and economic equity for all Rhode Islanders. Rep. Quezada, thank you for being with us today.
Absolutely. Thank you. Thanks for the opportunity to speak this afternoon. And thank you everyone for taking the time out regarding this important opportunity for our state to really make a difference for families and communities. And I offer a shout out to my colleague, Representative Marcia Ranglin-Vassell, for being a champion of this legislation in the House of Representatives as its prime sponsor for the past few years. And hopefully this is the year that we will be able to pass it. She has used her voice and her energy truly on behalf of our communities. So, we have a fabulous and really diverse community of advocates and professionals here in Rhode Island who champion these issues for our family. And as was said earlier, I'm particularly thrilled that this is World Doula Week, and which is an opportunity to recognize the work and the role of doulas as they do the critical tasks of supporting the physiological, social, emotional, and psychological needs of women, newborns, and their families during the full perinatal period. Doulas have the ability to address not just the individual health issues, but also collectively to make a difference in regards to the health equity and health disparity issues that we're seeing. It's important to highlight really specifics, and I know everyone has gone through. I'm just going to give you some bullet points, though. The benefits of the presence of doulas in birth and throughout the postpartum period: reducing the incidence of C-sections, shortening the length of labor, potentially, reducing epidural and analgesic requests, increasing breastfeeding initiation and continuation, increasing the satisfaction of the mother and partner during the birth experience, reducing the incidence of postpartum mood disorders and identifying them early, increasing new parents' confidence in the care of their newborn. Is when you see it on paper, it maybe to someone it feels touchy-feely, but I know as a person who's had 2 children, of life and quality of outcomes issues that are impacted by doulas. With these benefits, it really would be ideal for all people to have access to doula services during their childbirth journey, but the services really have only been available to individuals who can afford to pay out of pocket. And to only individuals who've known that doula services existed. First, we definitely need to get these services paid for, and then we can start the education. I know that once we all succeed on this step, we're going to be back at it, getting to work, making sure that everyone understands what doulas really can do for them. So our work will not be done, even if we get it everything we're asking for this year. But it's not a surprise that people of color and low-income people are less likely to have access to the doula services, and our birth outcomes data really reflects that. Increasingly, data is showing the disparity in birth outcomes by race and socioeconomic status, and we can make a difference by supporting doulas for these communities. I'm going to go a little deeper on data for just a minute because I want to be clear on what we're advocating to change. And this is just a snapshot to demonstrate the urgency in this legislation. Every year that we can provide doula services is a year we can make a dent in this data. Black women in the United States are 4 times more likely than white women to die in childbirth. The maternal mortality rate for Black women is about 41 per 100,000 versus 11 per 100,000 for white women. Black women are more likely to have a preterm birth. Their preterm birth rate is 16% versus a 10% for white women. And they're also more likely to have low birth weight infants. These numbers, sometimes it's hard to get the grasp around X per 100,000, but one is a problem. So multiple times the risk is seriously a problem. And then we need to think about these statistics in the context of family, the anxiety, the financial impacts, the long-term impacts, and then the ability of the children who do survive and the mothers who do survive to thrive socially, educationally, economically. These are the ways in which the strength of the work of a doula can make a significant difference, and all Rhode Island families deserve doulas. So I'm going to end my remarks with just a personal story and then the call to action. First, my story. So my son turns 21 in 6 weeks, but during my first pregnancy, I worked with midwives for my prenatal care, and because I had been working in women's health services at the time, I knew about doulas. And my husband and I, newly wed, low budget, we decided to invest in having a doula support us during my pregnancy. Meredith was our doula, and she played a significant role in our ability to manage the whole birth process. As I dealt with high blood pressure, she was really a wonderful advocate for us, especially as it became necessary. We realized that I needed to be induced. Even though I am able to navigate the healthcare system on behalf of others, I am terrible at asking for help. And having a point person whose job it was to advocate for me and to translate the medical perspective while I was in the midst of childbirth was completely invaluable. She additionally coached me through breastfeeding challenges in the weeks after my son was born. Her support was vital. The investment helped our whole family get started on the right foot. I believe every family should have access to these services, and that's why we're all working together to help make that happen. My request to all of you is that you make your voice heard on behalf of families and pregnant people and to help our children reach their full potential. So make sure that your representative knows how important this bill is to helping address birth outcomes and disparities. The majority still in our legislature are men who have never been pregnant. So some of them need education about what is a doula. Make it simple, make it easy, help them understand. But also find out where they stand. Some of them are already on board and you just need to say thank you. But others need to understand that this is critical and urgent. We need to do it now. And then making sure that our governor and his team understand that supportive doula services really will help families have good health outcomes right from the start. So there's some information available to guide you. I'll put a link in the chat. And of course, please feel free to always reach out to me. And I'm happy to provide any additional information and cheering on of our efforts. Thanks.
Thank you so much, Rep. Kassar. You are one of our many steadfast supporters in the legislature of right from the start priorities, and we really think the doula bill has a very good chance this year. I know on the Senate side, the majority leader at our kickoff expressed his strong support for the doula bill. So we're excited about that, and I am just going to, I know we are over on time. I am going to share, oops, hold on, current slide. Okay, I have the list of upcoming events, which is getting shorter because we've gotten a lot done. So we have 2 events coming up, one on Wednesday, April 7th, which is our Worthy Wages conversation about the Rhode Island Early Educator Investment Act. That's a bill to set goals for wages for early educators who work with infants, toddlers, and preschoolers in childcare, early intervention, family home visiting. Like doulas, they are very underpaid, under-resourced field. So that will be on April 7th. On April 28th, we'll have our annual Rhode Island Strolling Thunder Family Advocacy Day with legislators and a watch party for Rhode Island Child Care Awareness Day. And stay tuned because we may be scheduling one more event to focus on the 12-month postpartum Medicaid bill as well, which is a new topic, but a really important one, very aligned with the doula services focus area as well. So with that, I want to say thank you all for joining us, and we are happy. Today is this is World Doula Week, so we're happy to celebrate World Doula Week with all of you today. So thanks a lot, and hope to see you in a couple weeks.